discharge, the nipples are like a bloody nipple. Here you can see the red nipples. Itching is there and the nipple become hard. Now this is the one type. Now come on to the next type. Please don't see that why I am seeing this picture, because these are important to know about. Now coming to the angiosarcoma. What is angiosarcoma? It is one of the rarest cancer found in the lymph vessel and blood vessel. Now lymph vessel and blood vessel present in the human body in any type. Now it basically when happens within the breast, within the blood vessel and lymph vessel present surrounding the breast, that is known as angiosarcoma. The swelling is there, lesion is there, as well as swallow and purple regions are there. Here you can see the outside of the breast, there are swallow and purple regions. Okay, so these purple type of swallowing regions are there. These are known as angiosarcoma. So these are rarest types of cancer which affect the lymph vessel and blood vessel. Now coming to the next one, ductal carcinoma in situ, DCIS. Now ductal carcinoma in situ is a particular type of condition where the milk ducts start to produce the abnormal cell growth. What happened, and this condition leads to breast cancer. It does not spread to the other part of the body, only it is present in the duct. That's why it is known as in situ. That is, only this cell growth is present in the duct system. There are various symptoms, like there is formation of breast lump. A lump is formed within the breast as a bloody nipple discharge, the nipples containing the blood. Now what happened here? Here you can see in the right hand side that the ductal carcinoma in situ occurs, that the various cells are growing within the ducts. Within the duct, the cells are growing in high amount. This is known as ductal carcinoma. Okay, now coming to the next one, what is inflammatory breast cancer? So this is known as inflammatory breast cancer. What happened here? The inflammatory breast cancer is also very rare and very aggressive disease. What happened here? The cancer cell blocks the lymph vessel. The lymph vessel present in the skin of the breast. Now what happened? The blood is not coming. There is an inflammation. The breast becomes swollen, become red and become inflamed. Here happen, the swelling is there, the breast pain is there, lymph nodes of the arm and both sides of the collarbone are expanded, nipple become flattened, as well as breast color become changed. It's more like a reddish or pinkish in color. So this is known as inflammatory breast cancer. Now coming to the invasive lobular carcinoma. Now what happened here? The invasive lobular carcinoma, that means the lobules which produce the milk within the breast structure. The normal lobules you can see in the right hand side in the lower part. In the upper part you can see that is the invasive lobular carcinoma, that means a large amount of cell growing within the lobules, and this is known as invasive lobular carcinoma. The breast becomes thick, a region becomes swelled, the nipple inverted, nippleটা ভেতরের দিকে ঢুকে আসে, the nipple becomes inverted, the nipple comes within the body and inflammation is there. Now coming to the next one, lobular carcinoma in situ. What do you mean by that? Lobular carcinoma in situ, ductal carcinoma is the cell growth within the duct, that is ductal carcinoma in situ. And if the cell growth within the lobules, here you can see that it is not going outside. This one is going outside, invasive, outside. The cell growth is outside. But here the cell growth is inside. That's why it is known as lobular carcinoma in situ. In situ means which happens within inside. So what happened here? The condition is there. Rapidly lobules are, high amount of cells are being there growing within the lobules. Okay. Now this is known as lobular carcinoma in situ. Now coming to recurrent breast cancer. Now recurrent breast cancer is a type of cancer that reappear after a cancer treatment. Why this happened? Because the surviving cancer cell, after radiotherapy, chemotherapy, all of that, there is some surviving cancer cell along with some undiscovered cell, they expanded. They are coming within the blood vessels and within the blood cell and produce again the cancer. So a distinctive breast lump is showing, bloody nipple, pain around the nipple area and inflammation of the skin. These are something. If after one cancer treatment, after the primary cancer treatment, after the cancer has been come, it again can come back due to that some undetected cells are also present within the blood. Okay, now coming to the next one, male breast cancer. So it's rarely occurred. What happened here? The bloody nipple discharge, the nipple become bloody. Change in the appearance of the nipple. Here you can see the appearance. It becomes swelled. Swelling is there, thickening is there, and the nipple become inverted. Okay. So male breast cancer treatment have various types of surgery, radiotherapy, chemotherapy. So it is very rare condition. Okay. Now coming to the next one. Sign of the breast cancer. So we have completed the types of breast cancer. Now coming to the signs of breast cancer. Now coming to the signs of breast cancer. What are the signs of breast cancer? First of all, the retracted or inverted nipple. The nipple comes within the body. Next, breast or nipple pain. There is pain outside the nipples. There is lumps is there outside the nipple area, lump of cells are accumulated. This is known as lump. Redness or rashes can be there. The nipple outside of the nipple becomes swelled. The nipple is containing a discharge. Now, if you are not lactating mother, the milk cannot be discharged. But when there is discharge of some white compounds, these are known as the sign of breast cancer, some secretion. Also, skin texture is changed to the rough one, as well as lump is found around the collarbone and underarm. That's also a symptom of a breast cancer. Now coming to the next one, early sign and symptom. What you should always check, nipple discharge, if there is any lump, if there is any texture change, the color becomes redness or pinkish in the breast area. Pain is there in the armpit, that is in the underarm area. Change in the nipple, visible lump is there outside the nipple. Dimpling is there, some dimpling is there within the nipple. Pooled in nipple, the nipple become sore. The skin irritation and skin dimpling, all these are the early symptom of breast cancer. Now these are some rare symptoms of breast cancer. First of all, skin dimpling that begins to resemble an orange pills. The breast looks like a orange pills. Okay, here you can see in the right breast. Breast puckering. There is some puckering seen in the breast. Swelling is there. Rapid change in the shape. One breast where the cancer is there, that is the shape and size is high or big. Itchiness or scaly rashes are there, as well as pain in the breast after postmenopausal time. It is not common. Within the menstrual cycle it is common, the breast pain, but after postmenopause it is not common. Now coming to what are the risk factors. Now risk factors, there are various risk factors. First of all, family history is there, obesity is there, dense breast is there. If anyone has some fibrocytic disease in the breast or hormone replacement therapy, genetic mutation if it is there, or having one type of breast cancer before, then they have a recurrency of the breast cancer again, and hormonal imbalance. Okay, now coming to the next one. So what are the factors basically? First of all, the breast cancer have some endogenous risk factors, like at the age of full-time pregnancy, if at the age of menarche, that the starting of the menstrual cycle, age at menopause, these are the risk factors age. And if you have family history, that means we cannot change these things. And other than that, there is nulliparity. Now what do you mean by nulliparity? Nulliparity means that a female who has never given birth to a live baby, that means that is known as nulliparous or nulliparity. That means they have a high risk of developing breast cancer. A female who has never given birth to a live baby or have some pregnancy related complications. Now coming to the exogenous factors like alcohol consumption, obesity, radiation, exposure to various radiation, dietary fat, chemical carcinogen, all lead to breast cancer. Now coming to causes and risk factors of the breast cancer. What are the causes and what are the risk factors? Now we come to that. Family history is there, gene mutation is there. Along with that, the late childbearing, early menstruation and late menopause, obesity, breast density is increased, Oral contraceptive, if you use the oral contraceptive regularly to inhibit your pregnancy, that will lead to the breast cancer. Now, this is the one of the leading cause of breast cancer in any woman nowadays in India. Prolonged use of oral contraceptive. Hormone replacement therapy after menopause lead to breast cancer, and alcohol or tobacco intake also lead to the breast cancer. Now, what are the etiological factors? More or less they are same. Birth control pill or medication like oral contraceptive is the main reason of developing breast cancer. Next, there is underactive thyroid gland. If anyone have a problem with pituitary gland, if anyone have a surgery on the chest, these lead you to the abnormal growth of the cell. If there is any cyst in the nipple, it can develop into the malignant cell. If there is meningitis or any other types of viruses, this can lead you to the breast cancer. And if there is any other medical problems like kidney failure, liver disease, etc. These also can lead to breast cancer, but these are not some common disease. Okay. Now coming to the pathophysiology. Now what are the pathophysiology of cancer? First of all, if there is growth suppressor, if there is the replicatal immortality is there, resisting cell death, proliferation, all these are pathophysiology included in the pathophysiology. Now this is the ultimate explanation of the pathophysiology. You can say the breast cancer is a malignant tumor where it is starting the cell growth in the abnormal amount within the breast. Why this happen? First of all, DNA can be damaged and there may be genetic mutation. Coming to that, there are some genetic defects in the DNA and genes like BRCA1, BRCA2 and P53, which lead to the breast cancer. Next, the immune system normally seeks out the cancer cell and cell with damaged DNA and destroy them. But what happens in breast cancer, the immune system become defective. And there are also several signaling system of growth factor and other medication that interact between the stromal cell and epithelial cell. Okay, so disrupting these may lead to the breast cancer as well. So these are the things of breast cancer. Okay, pathophysiology. Now these are the main things. Be breast aware. This is very important. How to reduce the risk of breast cancer? First of all, having children, especially at a younger age, better to take the baby within 35. After it's normal nowadays, but there are some complications, and breastfeeding is the ultimate one to reduce the breast cancer. It is very necessary to breastfeed your child. Reducing your weight, increase the physical activity, reducing the alcohol intake, avoiding the oral contraceptive, and having regular breastfeeding. That is very important. Now on the coming slides, I will let you know what do you mean by breastfeeding, and everyone should do that. Okay. Now coming to the clinical presentation. Now breast cancer may be asymptomatic. It is not symptomatic. We cannot detect it. The hallmark sign and symptom of ductal carcinoma are a lump in the breast and breast tenderness is there, but there is no pain. Next is lobular carcinoma. There is no lump. So it is very harder to detect. Ductal carcinoma is better because there is the lump formation. But lobular carcinoma, there is no lump formation, so they are not easily detected. Also, there is a change in the breast texture. There maybe the texture become rough, and also the lymph node enlarged is there. Now coming to the next one, that is diagnosis. How we can diagnose it? First of all, mammogram. Mammogram is a process, just like the USG. Mammogram is a process where showing a normal breast and the carcinoma breast is there. Mammogram and the ultrasound is there. Breast MRI is there. IR thermography is there. Hormone receptor test is there. If someone is diagnosed with breast cancer, hormone receptor tests are there to know the amount of the Okay, now coming to that there is also some hormone therapy and is recommended for for various treatment. We have to know the estrogen and progesterone level. Now coming to that, there is some HRE2 or new test, that is the human epidermal growth factor receptor test, to know that which is a protein that can sometimes be found in the cancer cell. If this protein is there, then there is some cancer cell present in your body. Okay. Now coming to the systemic involvement, what we can do, breast cancer has that has some that has mastatitis can be manifested in several ways. First of all, bone. It is the most frequent site of metastasis in both men and women. So there is a shoulder pain, back hip pain, pain in the weight bearing joints, that is there, as well as your central nervous system is affected if you have the cancerous symptom, like your thoracic duct, thoracic level of spinal cord is there. There is neck weakness, lumbar spine detected, bladder symptoms are there. These are there, as well as lung, brain, liver, as well as remaining breast tissues are the sites where these can be affected. And the last but not the least, that is paraneoplastic syndrome, often present in the waist, that's still uncorrected with the cancer. Okay, so these are the things. These system like central nervous system, bones, these are involved within the breast cancer. Okay. Now coming to the next one. Breast cancer often requires the surgery as a part of curative treatment, and in most early stage breast cancer, surgery is the first step. Okay. Now there is mastectomy or breast conservation surgery. Following surgery, there is the radiation therapy, then endocrine therapy, that is means the hormonal therapy is there, and along with that chemotherapy is also there to reduce the aggressive tumor growth, and also do the negative impact to estrogen, progesterone, and HRE2/NU, that is a protein present in cancer cell, that reduce the level of the receptors. Okay. Now all these are there. Now coming to that, management of the breast cancer. Now surgery is there, chemotherapy and hormonal therapy is there by giving the estrogen, progesterone. Radiation therapy is there, physiotherapy, nutrition and psychological therapy, of course they are present in every situation. Along with that, radiology, nuclear medicine, pathology is there. Okay, now coming to the next one, common breast cancer treatment. Now what is the common breast cancer treatment? First of all, surgery. Depending on the size and stage of the tumor, you may have some breast tissue, the removal of the breast tissue. That is known as the lumpectomy. Okay. Now radiation therapy is there, very high energy X-ray is coming through the cancer cells, and along with that the cancer cells are destroyed by the radiation. There is also some medication which helps to kill the cancer cell. Okay, now another one is cancer. These things are known as the chemotherapy or hormonal therapy, also increase the immune system, and the next one is complementary. Treatment can sometimes wreak as havoc on the cancer itself. So then the acupuncture, talk therapy, yoga, massage, these things are very, very important, because psychological health should be maintained for a patient. Okay. Now coming to the dietary management of the breast cancer, now this is very, very important. Foods that may reduce the breast cancer risk. What are they? Cruciferous vegetable you should include, soybean products, legumes, onion, garlic is there, various types of berries, these are very, very important, blueberries, raspberries, green tea, strawberries, citrus fruits and fatty fishes. The fish containing the vitamin A and vitamin D, as well as the fish oils. These are helpful to reduce the breast cancer. Now nutrition during the breast cancer treatment, what we should follow? First of all, maintain the healthy weight. No overweight can be entertained, as well as balanced diet is there. More fruits and vegetables contain antioxidants, that is very, very important for reducing the breast cancer. Less processed red meat, you have to substitute with the fish and poultry and take the less processed and red meat, less amount. Avoid the saturated fat, so try to take the linear fats as well as low fat milk and unsaturated fatty acid. Whole grains instead of the refined grains, it is better to take the whole grains because it contain more water soluble vitamins, minerals, fibers like brown rice instead of the white rice. Okay. Now coming to the next one. Healthy diet pattern. So these are the healthy diet pattern. Phytochemicals should be included. Now these are the main sources, main dietary sources. Phytochemicals should be included. Carotenoids, polyphenols should be included in the diet. Fiber should be there. Moderate, less than moderate alcohol, that should not be included. Timing is very important. Omega-3, omega-6 fatty acid, polyunsaturated fatty acid is very, very important. Whole grains should be there. Okay. Now this is the healthy diet pattern. Okay. This should be followed. Now coming foods to choose on the breast cancer diet: apple, seeds, broccoli, fish, beans, garlic, nuts, cauliflower, lentils, orange, oats, whole wheat bread. These are the very, very important for the breast cancer. Now these are the foods to choose on the breast cancer diet. This will be very, very helpful to reduce the risk. Now coming to the next one, we are now coming to AICR recommendation for cancer prevention. Same things are there. Be a healthy weight, physically active, limit the consumption of the sugary beverages, limit alcohol, limit the processed meat, eat a diet rich in whole grains, vegetables, fruits and beans. Now limit the consumption of fast food or junk food. For mothers, breastfeeding is very, very important. After a cancer diagnosis, follow the recommendation and please do not use the oral contraceptives as well as any supplementation for cancer prevention, because cancer cannot be prevented by any supplementation. Now coming to that, phytochemicals, these should be included in the diet properly, because these are the ultimate one who will fight against the cancer. Carotenoids, which is present in various yellow, orange and green vegetables and fruit. Isothionates, present in mustard, cruciferous vegetables. Phenolic compounds, present in garlic, green tea, soybean, flaxseed. Flavonoids, present in most fruits and vegetables. Organosulfides, present in garlic, onion, cruciferous vegetables, leeks. Next, isoflavones, present in soybean, legumes. Indoles, present in cruciferous vegetables, broccoli, cauliflower, cabbage. Now these should be included in the diet because these contain the phytochemicals and these are the very rich sources of antioxidant which should be included in the diet for the management of the breast cancer. Now these are the very important things to keep in mind. And ways to reduce the breast cancer risk: first of all, smoking should be prohibited. Control your weight, limit and avoid the alcohol. Breastfeeding is very much necessary for a mother should follow. Physical activeness is very, very important and radiation exposure should be limited or avoided, because this can cause various types of other problems. These have been given by the World Health Organization. Now coming to that, want to look out for what you want to look out. First of all, everyone should do that. Everyone, not only those who have a breast cancer or have a risk, everyone should do that. First of all, look for the change. If any change like puckering or dimpling is there within your breast or any lump is there, look for the nipple discharge. Any discharge is coming out through the nipples. Those are not the lactating mother. Okay, next is look for the nipple inversion and changes in the direction. If anything, nipple is inverted within the body. Look for any swelling is there around your underarm or around your collarbone. Feel constant pain in your breast. Look for a change in the size and shape. And look for a rash of crusting of the nipple or surrounding area. So these should be properly look out, because this is very, very necessary to reduce the risk. Now what should we do? Breast self-exam is very, very important. You just sleep, you just lie down, and manual inspection do every month. Do every month, okay? Do every month you should do that. Breast self exam. Manual inspection is very, very necessary. Okay? So when you are there, I think everyone you are there, the maximum of the students, I think the 95% you are the girl. Okay? You are the females, and the breast cancer risk is very high in females now. So every month you should do that. What? Like you lie down, take your hand in your breast. Here you see that the fingertips close together. Each of the breast, you do that. Just move your hand just like that, up and down. Here you can see in the first one, up and down, and then the circuit cycling, and then in the full from every side you put the hand. If you feel any lump, anything is there which is not happening, any lump, any roughness, any rash, anything, go to the doctor. That is very, very important. Please don't do any type of self-prescribed medicine, or don't take any type of self-prescribed medicine. Please go to the doctor. That is very, very important. And this breast self exam is very, very important. It is not any shame. I am just presenting in front of the public. It's a public platform. A lot of students are there, and also this is not of shame. Everyone, every girl should do that. And those, I don't know how, if there is any male student is there, also they should tell their mother, their near and dear ones, their wife, everyone, their
ম্যাম কিছু শোনা যাচ্ছে না।
Am I audible now?
Yes ma'am.
Yes ma'am.
Yes ma'am.
So whatever I have told, that do this screening every month. Put your finger, put your hand above the breast, up and down, cycling, and coming. Put your hands from every side of the breast. If you feel any lumps, any rashes, any skin roughness, anything is there, go to the doctor. Okay? So how to do the examination? These things are there. Touch, look, check. Use your right hand to examine your left breast, then take your left hand to examine your right breast. Feel for any lump, anything, any spot, any change. A circular pattern may help you to make sure. Okay? With the pads of your 3 middle fingers. Here you see the 3 middle fingers. Press on every part of one breast. Use light pressure, then medium, then firm pressure. Then press the tissue nearest your armpit. If you feel any pain, anything, then you should check up. Be sure to check under your areola, okay, under your nipple, under your area around your nipple. And then squeeze your nipple to check for any discharge. Squeeze your nipple. If there is any discharge, if you are a lactating mother, of course milk will come out. But if you are not a lactating mother, or if you are not a married also, so nothing will be discharged. So if check for that and repeat the step on the other breast also. Okay? So first take the 3 pads of your middle finger, press your breast. First of all, the hand should be properly drawn in a circular pattern, whatever I told in the previous one. Next, with the help of your 3 fingers, press the breast. First light pressure, then medium pressure, then firm pressure, and then within your underarm. Be sure to check under the areola, just outside the nipple area, that will be a brownish area, and along with that, squeeze your nipples. if there should be no discharge. So tough look check is very, very important. And this is the self-breast exam. If you feel something wrong, go to the doctor. Don't be late. Thank you so much everyone for listening to the presentation so carefully. So I think you have enjoyed the class because these things are very unknown to us and these things are interesting also. Have you learned something new?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. Do you have any queries? And as this class is very, very important, this class has been recorded. So this class have been recorded. So also we will also upload this class in the Google Drive. Okay. What is Paget disease? What is Paget disease? Sorry. Just a minute. So Paget disease is basically the first type of the breast cancer. Here you can see in the picture, this one is known as the Paget disease. This is the rare type of cancer where the skin of the nipples are there. The nipple skin is only have been affected. It has been not been grown outside, and most people with the Paget disease have more than one or few more tumor in the same breast. And this is all accumulated within the nipple area or the areola area. And this areola becomes bloody red. So this is known as the Paget disease. Any other thing?
Ma'am, can you explain the lobular and the ductal breast cancers?
Yeah. Here for that I am not going to the other slide. Here you can see that is lobule and that is coming that outside the lobule there is a small duct is there. The lobules are the red one and the ducts are out just which is the lining of the lobules that is known as duct. If the cancer occurring within the lobules, the lobular cells become having the cancerous growth. The abnormal growth occurs within the lobules that is known as lobular cancer. And lobular cancer, if it is not spread outside, it is spread only inside, then it is known as lobular in situ cancer. And if the cancer happens within the duct area, here you can see the ducts, the greenish portion below the nipples, the duct, which it happens within the duct area. The duct area is there which takes the milk to the nipple area. Okay, so if the duct contains the abnormal growth of the cell, that is known as ductal cancer or ductal carcinoma.
Okay, ma'am, understood.
Any other queries?
Ma'am, can you explain the recurrency of the cancer again?
Yeah, of course. So I'm going to the slide, recurrency of the cancer. So recurrent cancer happen if one time you have a breast cancer and after the various types of radiation therapy and surgery and all, you have done your cancer treatment. But there are some undiagnosed cells may be present, maybe, not always, but may be present within your blood vessels, within your blood capillaries. So they can grow, they can be malignant, they can be lead to an abnormal growth and leads you to recurrent breast cancer. Now why this thing is important? That means if you have one time you have a cancer, that doesn't mean it cannot be repeated. It can be repeated. Recurrent breast cancer can be there. So the cancer can be repeated. That doesn't mean if one time you have a cancer, you done the treatment, that doesn't mean the cancer is gone. It can come anytime. Because there are some undiagnosed cells present. If these cells become malignant due to some genetic manipulations or genetic conditions, then again the cancer can happen.
Okay.
Any other queries? ইনভার্টেড নিপল কোন ক্যান্সারে দেখা যায়? মোর অর লেস সমস্ত কিছুতেই, তাও ম্যাক্সিমামে ইনভার্টেড নিপলটা this one, invasive lobular carcinoma. Next one is inverted nipples. Also, it can see in angiosarcoma, and this one is the more faggot disease. There is the inverted nipple. The nipple is coming within the body. And within male cancer, always it can be seen. Inverted nipple.